So thank you all so much for joining today, and thank you so much for Caroline for putting up my slides. I am so excited to be here with you and to share with you about our course. We can go to the first slide, please. The Prep for CNOR is a great course taught by our instructors who have a lifelong passion for perioperative nursing as well. And they are so focused on helping you to prepare and pass your exam. We work together with our instructors to write the learning outcomes. And this outcome really speaks to just what Renee was talking about, completing our professional development activity, specifically around certification for perioperative nursing. This course will help to increase our knowledge of the current evidence-based perioperative practices, as well as the perioperative strategies and preparation strategies to successfully complete your CNOR exam. We are confident that you have this knowledge because you have the experience. You know how to take excellent care of patients. We want to help you translate that knowledge into the exam so that you will be successful and become a certified perioperative nurse. That's our outcome for you, and we want to help you achieve that. The next slide is around our objectives. We will go through evidence-based perioperative nursing principles and practices. And so this will also focus heavily on the AORN guidelines, as well as a couple of different textbooks that are referred to quite often on the exam. We use Berry and Cohn's operating room techniques, Alexander's care of the surgical patient, so keep those in mind. Some of Drain's critical care nursing, so keep those textbooks in mind. And that will help us to discuss the key components of the nursing process related to perioperative nursing care, specifically the perioperative nursing data set, also referred to as PNDS. And that is the standardized nursing language that helps us define the amazing care that you're providing each and every day to your patients and define our profession. We talk about test strategies to help you maximize your performance on the CNOR exam, just things to think about, how you translate your brilliant wisdom and experience into that test question. And we also help you to develop a personal study plan. And that really starts the first day that we have the course. How do we start to help you prepare for your exam? What's going to be the best way for you to prepare and develop, put your study plan together? Next slide, please. In our 3 days together, you will have, during your registration, as I mentioned, your in-person sessions will be taught by people who very much know perioperative nursing. This is their passion. You receive access to 2 online assessments. One is a medication assessment, just to go through medications that are commonly used and administered in the perioperative space so that you refresh your knowledge around those medications and the IV fluids and the patient care associated, as well as the guidelines assessment from the AORN guidelines book, just to help you start taking questions formulated around the AORN guidelines so that you can start to think about how you translate your practice into those test questions. We provide a study plan as one way to think about how you break up this course content so that it looks very digestible and very easy to walk through and learn and prepare for your test. You get 6 months of access to eGuidelines Plus, which is the electronic tool that gives you access to AORN guidelines, as well as several other tools within AORN guidelines. So many of us learn differently. Some of us learn from books, some of us learn from courses, some of us learn from text, on screens, audio, visual. And by providing this course, many thanks to the Compass team for providing that and giving you access to eGuidelines Plus, it's putting together that blended learning content so that whatever is the best way for you to learn, you will have access to that content. Upon completion of your assessments, your sessions, and evaluation, you do get 18 contact hours. And we also provide you additional course information in your emails. So it will be important that we have your preferred email when we get you signed up so that we can give you additional information. That's what comes with your registration. So it's more than just our 3 days. The first day that we are together, we will start off with some welcoming and we will walk through eGuidelines Plus. If you've not used it before, we would like to walk through that with you. We would like to show it to you so that you can see how many resources are available. It's actually more than just the guidelines, and that's why we call it eGuidelines Plus. So our instructors will walk through it. We encourage you to ask questions while you have access to the instructors, and please feel free to reach out after the course as well if you have any questions, because we are happy to answer those and help you. When questions are asked during the course, oftentimes what we will do is we will go back to eGuidelines Plus so that we can walk through eGuidelines Plus, look for those questions, look for their answers, so that we all become much more familiar with how to navigate that rich resource. The first day then continues with nursing process and professional accountability, much of what Renee spoke to. We move into aseptic practices, gowning, gloving, scrubbing, etc. We talk about our critically ill patients, specifically around blood gases and lab values, because those will be on the exam in some form or fashion. The critical components of positioning, pressure injury, and safe patient care and handling to keep you safe, as well as keeping your patient safe so that you're always there for your patients when they need you. Our specialty equipment, specifically electrical surgical units, pneumatic tourniquets, things of that nature. Our surgical procedures post-op, how do we take care of our patient when they move to the recovery phase? And team communication, specifically around counting and prevention of that retained surgical item. So that is day one, which sets us up nicely to move into day two on the next slide. On day two then, is where we get to specialty equipment. So we did break this up a little bit differently so that they are not so content intensive. Moving to surgical procedures and team communications. We then talk about, again, brief guideline information and a game. So this is a game. So while it says brief guideline information, what it really is a little bit of a game where you get points for every question you answer correctly. That is facilitated by our instructors. We have built games in through the course so that it kind of breaks up the day. And again, another way to learn our content. We then move to principles of anesthesia. What are the different anesthetics? Thinking about malignant hyperthermia, which can be devastating for a patient and their loved ones, and then going on to safely caring for patients. Setting us up nicely then for our last session together, special patient populations. What are those different kinds of patients that we take care of? Some of it is around preventing DVT and clots. What's wrong with flex endo activity? So this is just a fun game to help us look at the sterilization environment and what is right in that space in that game and what needs to be fixed. Because then that sets us up for two chunks of content specifically around sterilization and disinfection. And so we do walk through that in two different modules because it is a fair amount of content. It may not be something that we are familiar with each and every day in our practice. We do encourage you, if you have access to your sterile processing space where they disinfect and sterilize our instruments, to go down there and chat with those colleagues and see what they do. It will help you prepare for the test and start to put some of those content elements into real life. So the sterilizers, your Bowie-Dick tests, your integrators versus your indicators, all those kinds of things you will want to know. We wrap up then with learning styles and test taking. So what works best for you? We talk through that. How can we help you? What else can we give you? What are the resources available so that we can help you with that blended theory approach? Some exam case test taking strategies that we have blended through all the questions you've seen over these 3 sessions. And then we do another potpourri of topics, which that is just more questions written in the form of the exam that you can practice with. And we walk through the content from the 3 sessions where we've been together over those 3 times. So that is a high-level overview of what the course looks like. Again, the instructors, Becca and Krista, are very, very interested in your questions. We are here to help you. We have broken that up so that we can spend time with you answering questions. So feel free to ask whether they are live verbally or in chat. We will have somebody on there to monitor the chat and be able to answer your questions whenever you have them. So with that, I will hand it back to Bassem, and so appreciate you. And actually, I applaud you for pursuing your certifications and demonstrating your excellence in perioperative nursing practice. Thank you so much.